October is Breast Cancer Awareness Month. Women's health providers and all doctors are encouraging all of their patients to get your annual screening, as early detection is the key to breast cancer survival. Earlier this year, we had the chance to sit down with local celebrity and news anchor Estela Casas, and she shared with us some incredible insights around her battle with breast cancer. So today, I'd like to share some highlights of that video and share some of her thoughts and words of encouragement. And be sure to stick around to the end, where I'll tell you the 3 things that you can do to reduce your cancer risk.
I remember you texted me. You texted me when I made my announcement on TV, and you were one of the first ones who said, "Hey, I'm here. I'm sorry to hear what you're going through, but I'm here for you." And I really appreciate that that you included me in your life, and I was able to include you in my journey as well. So that's important to me, and I have a feeling that is a connection that you make with a lot of your patients, because it's important for everybody to know that we're not alone. When we're in it, you forget that there are other people who've been through the same thing you have, and that's why it's so important to be able to share that, and be able to share that opportunity with you is also important, because the more you know, the more you are empowered to take care of your own health, and education is key, and you have to be your own advocate. I think it's important to tell these women, just like your first mammogram or your first pelvic exam, it's very important to tell women that they have to take ownership and own, many times what they're embarrassed, somebody else to see.
Yeah.
And I just remember you making me feel very comfortable and explained everything to me, what was going to happen. And despite the scariness of it all, you made me feel comfortable.
And I think one of the big things about our channel is empowering women to understand that they do have a choice. So a lot of women, they'll come and they may be suffering, and maybe they were suffering for a long time, and they're afraid to even go because they're embarrassed, or they have a story that someone they knew had a surgery, had a hysterectomy, and it was an incision, and they had problems, and they end up suffering, or God forbid, some patients even end up developing cancers because they were just afraid, or maybe even afraid that it was going to be uncomfortable, and that none of those things necessarily have to be the case.
Well, first of all, women need to know that you have to come in with a lot of questions.
Yeah.
And because we certainly don't know it all, so it's very important for a woman to come in with a list of questions that you will answer. And the more, the better relationship you have with your doctor, the better. But it's embarrassing. You don't like to talk about these very private things. And as a culture, the Hispanic culture, the Hispanic community, we are not used to going to get a pelvic exam or checking your breasts for lumps. Right. And
there's a taboo.
There is a taboo, although things have changed, but there's still some embarrassment there. And so I'm just very grateful that you made me feel comfortable enough to not feel intimidated or less than or embarrassed. And that's what I advise women, that you have to stop. You have to take ownership of your body. You have to take ownership of yourself to be able to ask all those questions of your doctor and stay on top of your health. So what happened to me is I'd had a mammogram 8 months before. And in 8 months, and I was on top of my health. Yep. I took care of. I was very well aware of my periods, and when there were changes in my body, I was very well aware and on top of my health. So I'd had a mammogram 8 months before, and I developed stage 1, stage 2, and this is somebody who's informed and educated about their health and an advocate and all those things, and it still happens. And it happens to everybody. You can develop cancer anywhere.
Vulnerability is not a sign of weakness, it's a sign of strength. And it's empowering to people to say, okay, well, this is someone, certainly I looked up to, many people look up to, and she's human, and these things happen. And if you have these questions in your life, you need to go and you need to get these questions answered. You need to have what other tests need to be done, and hopefully everything turns out fine. But occasionally we're going to find something, and when we do, the key for all of these things is early detection.
Absolutely. I've always advocated for early detection. You talk about vulnerability. It is very hard to be vulnerable. But what I've learned from being vulnerable is that you find strength in not only yourself, but in the people around you who give you that strength because you opened yourself up, because you became vulnerable. And everybody rallies behind you because you're real. Mm-hmm. You are raw. Yeah. And it certainly helped me. And it was really humbling, and I put myself out there every single day, with my wigs and with my fake eyelashes and with my nosebleeds during a newscast. Yeah. And but women need to know, and and men need to know too. But women need to know that we can and should take control of our health and be our best advocate and reach out to you. I'm honored that you've shared all of these vulnerabilities with me and with your audience, and I know the effect on that is immeasurable, and I appreciate you being able to help us send this message on our channel as well. A big thanks to Estela for sharing her time and her insights. We want all patients to get their clinical breast exam, do a monthly self-exam, and get a mammogram every year to have the best chance at early detection. And if there's any abnormality, don't delay additional testing. Thanks for watching. You all know someone who won't get screened or someone who has cancer and is suffering. Please share this video.